Have you noticed swelling, redness, or pain around your toenail? You might wonder if your toenail has become ingrown. While the condition I'm going to talk about today often accompanies an ingrown toenail, it's actually a common infection called a paronychia, or inflammation around the nail. Today I'm going to walk you through everything you need to know so you can understand exactly why it's happening and what we can do to treat and prevent it. But before I do, I'd like to introduce myself. I'm Dr. Rion Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written a free ebook called How to Avoid Ingrown, Black, and Damaged Toenails. You can download it in the description below. If you find this information helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video. What is a paronychia? It's one of the most common nail conditions I treat. Simply put, paronychia is an infection or inflammation that develops around your toenail when bacteria, most commonly staph or fungus like Candida, enters the area around your cuticle through a break in the skin. Here are the most common causes I see in my office. First, ingrown toenails. They are the #1 culprit. When the nail grows into the skin, it creates a perfect entry point for bacteria or fungus. Second, is trauma to the nail bed. I see this all the time. Maybe you drop something heavy on your toe, or you're wearing shoes that are too short, or you're a runner dealing with repetitive micro-trauma with the distance you run. Third, is poor toenail care practices. That is something I really want to educate people about. Cutting your nails incorrectly or frequent visits to nail salons with poor hygiene can set you up for an infection or an ingrown toenail. Fourth is existing toenail fungus. Fungal nails don't just affect the nail itself, they can affect the skin around the nails too. Fifth is diabetes. If you're diabetic, you're at higher risk for fungal paronychia, and this is critical because it can lead to foot ulcers and bacterial infections. This is why I always tell my diabetic patients, don't wait, get treatment quickly. Now, let's talk about how to recognize the symptoms of paronychia. Once you learn to identify the symptoms, you can get treatment more quickly. Here's what to watch for: redness, pain, swelling, and tenderness around the nail, particularly when you touch it or you have direct pressure from shoes or even your socks. Pus and blisters may develop, fever and red streaks. Particularly if you see red streaks spreading from the infected area up the foot, this means that the infection is spreading and you need immediate medical attention. There are two main types of paronychia. Acute paronychia develops quickly with the milder symptoms. The good news is that once we treat it properly, it typically resolves in less than a few weeks. Chronic paronychia develops more slowly. It's often caused by fungus and lasts 6 weeks or longer. This is the type that requires more patience and persistence from both the doctor and the patient. Here's what I tell every patient who comes to see me. Proper diagnosis is the key. I can usually diagnose paronychia by visual inspection, but we often run laboratory tests to determine whether it's bacterial or fungal because the treatment is completely different. For bacterial infections, we use an oral antibiotic and topical medications. For fungal infections, medications like oral Lamisil are very effective. Soaking the nail in warm water with Epsom salts 2 to 3 times daily can be helpful in reducing swelling and nagging pain. You can try this at home for several days to see if mild cases improve, but if after a few days it's not, you need attention. Sometimes I need to drain a blister to drain pus if it's present. If there's an underlying ingrown toenail, well, that will be needing treatment. To learn more about treatment of ingrown toenails, click on the link above. If you have toenail fungus, it will also need to be addressed as a part of a comprehensive treatment plan. Click on the link above to learn more about how we treat fungal toenails. The best part is paronychia can usually be prevented. Here's how. First, proper nail cutting technique. Cut your toenails straight across about once a month. Don't cut them like you do with a fingernail around. Don't cut them too short, and avoid sharp nail implements that can cause injury. Second, proper foot care. Keep your feet moisturized if they tend to be dry. Dry skin can crack and allow bacteria and fungus to get in. We offer great products to help you with dry skin at the office. Third are environmental precautions. Never go barefoot in locker rooms, public showers, or around pools. If you go to a yoga studio, bring your own mat. These places are breeding grounds for fungus and bacteria. Fourth, Wear proper footwear. That means shoes that fit you properly. Wear socks that wick away moisture. Fungus loves warm, dark, damp environments. Make sure your shoes fit properly and not too narrow at the toe box and not too long, which would allow your feet to slide back and forth and hit the toe. I see a lot of athletes, especially soccer players and rock climbers, who need to be particularly careful about the tight athletic shoes that they tend to use. Fifth, get ingrown toenails treated quickly. Don't wait until they become effective. Just like a splinter, almost as soon as it happens, it will become red. Sixth is nail salon safety. If you go to nail salons, bring your own tools and never let them cut your cuticles. Your cuticles are natural protection against infection. In summary, if you're dealing with toenail pain, swelling, or redness, don't suffer in silence. The sooner we diagnose and treat paronychia and any accompanying conditions, the faster you can get back to your pain-free living. Don't forget to subscribe to our channel for more patient education videos. And if this has helped you understand paronychia better, please share it with someone who might benefit.